Welcome and good morning, good afternoon or good evening, depending on what time you are taking this lesson. This is Mr. Kanwar, Director of Science. I've been doing this series of lessons on B5, which is paper 2. So homeostasis and response, again, it's B5 biology, it's paper 2 content. It is for all students, foundation tier, higher tier and triple students. So in the series of lessons, this is lesson 8 and your title is Contraception. Okay, so last we did about the menstrual cycle, and now we're moving on towards contraception. Okay, so on to our starter. Our starter involves just recalling some of the content that we learned last lesson. So I've got 5 questions for you. I'm going to give you two minutes to answer them, but I'll read out the questions first. So 5 questions. Number 1, where is testosterone produced? Number 2, where is estrogen produced? Number 3, what is the role of FSH? What does it do? Question 4, what is the role of LH, i.e. what does it do? And question 5, which gland stimulates the production of FSH and LH? As an additional, if you get a chance to, tell me what testosterone does, what estrogen does, and where FSH and LH. Well, actually, that's question 5. What are they produced? But what are the other 2 hormones involved in the menstrual cycle? 2 minutes, starting now. Okay, a minute remaining. So remember, if you've answered them already, tell me what testosterone and estrogen do. What are the effects of those? Okay, so let's go through these questions. Where is testosterone produced? It is produced in the testes. T-E-S, T-E-S. That's your answer for that one. Number 2, where is estrogen produced? It is produced in ovaries, and the easiest way to remember it is oestrogen, ovaries. What is the role of FSH? It's to stimulate the maturation or maturing the egg. So it stimulates the maturing of the egg. What is the role of LH? It stimulates the release of the egg. Okay, so FSH is maturing, LH is releasing. And then which gland stimulates the production of FSH and LH? That would be the pituitary gland, which you find in your brain. What are the effects of testosterone? Sperm production, muscle growth. What are the effects of estrogen? Well, it has a couple of effects. It inhibits FSH. And it also causes the thickening of the lining of the womb. Okay, so there are your answers. That's a recap of previous learning. Let's continue with today. So what are we going to do, or what are we going to talk about today, or what we're going to learn about today? Our challenge is describe the different hormonal and non-hormonal methods of contraception. So we'll talk about what contraception is, And then we need to be able to categorize two different methods, hormones and non-hormonal methods. You probably do know a little bit about this already. And our Aspire evaluate the different hormonal and non-hormonal methods of contraception. The type of exam questions you get on this, in particular, are those questions where they give you some information about different methods of contraception, and you have to either compare or contrast, or you have to evaluate which one would be the better method depending on the circumstance that they have given. Okay, so there's a lot of comprehension with this topic, as well as just knowing the different hormonal and non-hormonal. So what contraception methods do you know? Can you name them? And as an additional point, can you describe what they actually do, how they function? Now, in case you do not know, and I should really explain what contraception is basically something that stops people from having babies or children. Okay, so it stops the process of fertilization. That's when an egg and a sperm come together. Okay, so it stops fertilization. There's lots of different ways to stop fertilization. That's what I'm asking. So how could you possibly stop them? What are the different methods? And describe how they do. I'll give you 2 minutes. Okay, so hopefully you've managed to get quite a few answers. I know, for example, you would have learnt this in either live GCSE or in previous science lessons when you were in the younger years. Okay, so just before we carry on, there's just an activity that I'd like us to do with your list that you've got in front of you. So we know that fertility can be controlled by a variety of either hormonal and non-hormonal methods of contraception. You've got a long list, hopefully, or you may only have a list of like 4 or 5. Now, there are certain ones of those in that list that require or controls hormones to make sure that fertilization does not occur, or to stop fertilization, or to be a method of contraception. There are certain in your list, certain methods that are non-hormonal. So therefore they could be barriers, they could be all sorts of other things, but they don't basically alter your internal chemistry. So they have nothing to do with your hormones. Now what I'd like you to do, go through the list carefully and just jot down a H or an NH next to it, just so you can just so we know, or you can have a think about whether they're hormonal or non-hormonal before we carry on. Okay, I'll give you just 30 seconds to do that. It shouldn't take long. All you need to do is a H and an NH. You already know what list you've got. This would normally a buzz and go. So that's how we can categorize them into 2. So 30 seconds from now. N, H or H? Okay, brilliant. If you've not managed to do that, just pause the video. That's absolutely fine. What I'm going to do now, keep that list. We will go through that as we go through this lesson. However, I'm going to show you a short video on certain methods of contraception, and then what you can do is if you've got them kind of right, you can just kind of tick them off. Okay, it's a video done by the NHS, so it's quite informative and it's quite categoric in terms of it just tells you the facts. That's what's up next.
There are many different types of contraceptives available, and it's very important that women should find out about all of them so that they can make an informed choice. Condoms, whilst they're readily available and are very good protection against sexually transmitted infections, are recommended to be used in conjunction with another, more reliable method of contraception. The cap is a small soft rubber dome that's placed inside the vagina just prior to intercourse, together with some spermicide jelly. It's a very good method of contraception and is ideal for women who don't want to use any hormonal method. There are two types of contraceptive pills. There's the combined oral contraceptive pill that contains estrogen and progesterone, and also there's a mini pill that only contains the progesterone. So if a woman doesn't want to have estrogen, we can offer her a progesterone-only pill. Apart from the fact that it makes the periods very light and short and pain-free, it also, the combined oral contraceptive pill, reduces the risk of 3 types of cancer by 50%, which is a huge health benefit. They are both very good forms of contraception, but they do rely on the women remembering to take them. If a woman doesn't want to have to remember to take something every day, but wants something that's completely reliable and puts her completely in control, then the long-acting reversible methods of contraception are highly recommended. The LARC methods are very suitable for all women of all age groups, including women who haven't had any children. The implant is a very discreet 4-centimetre little tube which is full of progesterone hormone. We inject it subdermally, usually in the upper arm, so that it can be felt but not seen, and it is very, very effective contraception for 3 years, so it really is fit and forget for the woman. It can be taken out any time that the woman decides to change to another method, and when it is removed, fertility returns to normal within a month. The IUS is an intrauterine device that is fitted inside the uterine cavity. It contains a very small amount of progesterone hormone, which is released over a 5-year period. It has this wonderful added benefit of not only being very, very good contraception, but making the periods very light and very short. And in fact, in 85% of women, the periods will stop after about 6 months. Once it's removed, fertility returns to normal within the first month. It's very easy to fit and is a very simple procedure that can be just done in the clinic. Once it's in, people aren't aware that it's there at all. The copper IUD is another intrauterine device that has no hormones in it at all, but just copper. And this is ideal for women who want to have a method that is highly reliable, but that they don't have to think about without having any hormones. The copper actually acts as a spermicide, killing the sperm, and it's very, very good contraception. Again, once it's removed, fertility returns to normal immediately. The only downside of the copper IUD is that it can cause the periods to become slightly heavier and slightly longer. Most of the copper devices available that we use in this country last 10 years. There is another benefit to using this method. It has been shown that it reduces the incidence of endometrial cancer by 50%. The IUS and the copper IUD are suitable for all women of all age groups. The contraceptive injection is often called the depot injection. This is very, very good contraception, and it is given once every 3 months. It often makes the periods disappear altogether, which women love. Whilst it is very popular contraception, women have to bear in mind that there can be a delay in return of fertility once they stop taking it. And it can take 18 months for the fertility to return to normal. As a last resort, there are 2 methods of emergency contraception available for women who have either had a contraceptive failure or who have failed to use any method at all. These consist of the emergency hormonal contraceptive pill, and also there is a copper intrauterine device that can be fitted. So whichever method of contraception is best for you, always remember, in order to prevent sexually transmitted infections, also always use a condom.
For more information, visit www.nhs.uk.
Okay, so hopefully we managed to get some information in regards to that. Now what we're going to do is we're going to get down some key aspects for each contraception method. Okay, so you've got your original list, you probably corrected it, or you may have got it completely right whilst watching that video. So that was kind of a bit of a background on all the different types of contraception methods. It didn't go through all of them, but it went through most of them. It spoke about hormonal, non-hormonal, etc. Now what we're going to do, so this is very much an information gathering exercise, is you can either make a table or you can just put a subtitle with point 1, 2 or 3 for each one. So we're going to go through, it's going to be kind of like a carousel, but obviously we'd normally do this differently in lessons. We'd pass around the sheets of paper, the info sheets and so forth, and we'd collect the information. However, I can't do that with a video. So what I'm going to do is I'm going to go through each one individually. So question number 1 is it hormonal or a barrier method? Question 2, how does it work? And that only need be 1 sentence, just so you have an idea of how it works. And number 3, quite an important one, how successful is it? Okay, how successful it is. So those are our 3 questions that we're going to ask. And what I will do is I will go through each information sheet. So I will read it out for you, because some students will prefer me to read it out. Alternatively, you can hit the mute and you can pause the video and you can get that information as I run through the slides. Okay, so let's start with first method, which is a barrier method, and it is condoms. Okay, you can get both male and female condoms. The female ones are generally called femidoms. So there's an illustration on how one puts on the male condom and how the female one is inserted. So what do they do? So this is a barrier method. So this is our first one. So it's non-hormonal. They prevent sperm from reaching the egg. That's what they do. Okay. Condoms are the only type of contraception that both prevent pregnancy and protect against STIs, that's sexually transmitted infections. If you do not wear a condom, or if you do not wear a femidom, then there is still a chance, doesn't mean you will, there is still a chance that you can get a sexually transmitted infection. There are, like I said before, there are two types of condoms: the male condom, which is worn on the penis, and the female condom, which is worn inside the vagina. When used correctly, it is 98% effective. Okay, so that basically means that 2 out of 100 women will become pregnant in a year when male condoms are used as contraception. Now that's because of various things. It rips, it comes off, it's not being placed on properly, and so forth. Female condoms worn inside the vagina are 95% effective. Again, it's more about whether it's being placed in the right situation, so to say. Because if it's not placed in the right situation, then it may rip, tear, come out, and not work as it should. Okay, so that is the barrier method, and that is condoms. I'll just give you 30 seconds to complete. So remember the 3 questions. Is it a barrier method or a hormonal method? That's number 1. Number 2, what does it do? And number 3, how successful is it? Okay. So the next one that we have got is also a barrier method, and it is called the diaphragm. Okay, so it's only placed in females. You can see an image of it in front of you. What do? They prevent the sperm reaching the egg. Now, this is a common thing. If it's a barrier method, that's generally what it will do. When used correctly, and you've got to use spermicide, okay, and we'll talk about what spermicide is. So you've got to use spermicide. A diaphragm or cap is 92 to 96% effective at preventing pregnancy. Okay. A diaphragm or cap is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix, so therefore the entrance of the womb. You also, like I said, need to put spermicide in or around it, and that's what kills the sperm. You only have to use a diaphragm or cap when you have sex, so it's only something you basically have to kind of prepare before, but you must leave it in for at least 6 hours after the last time you had sex. You can leave it for longer than this, but don't take it out before. And the reason being is because it captures the sperm, and the sperm can survive within the womb, within the cervix, for quite a long time. So you need to allow the spermicide to work to kill the sperm. Okay, hence it's 6 hours. So what I'm going to do is I'll give you 30 seconds. Remember your 3 questions. Is it a barrier method or a hormonal? What does it actually do? And how effective is it? Okie dokie. So, number 3. So this is another barrier method, but it's also a hormonal method, and it's called the IUD. Okay, so it's an uterine or uterine device, and you can see there's an image there of the vagina and the uterus, and you can see how it works. So it's got a piece of string at the bottom. That's for you to pull it out, essentially, and then it's got like a long tube, and then it's got like a kind of handlebar. So it looks like handlebars, essentially. So an IUD is a small T-shaped plastic and copper device that's put into your womb by a doctor or a nurse. What does it do? It prevents implantation of an embryo or release of a hormone. It depends on which one it is. So it doesn't stop fertilization occurring. So the sperm still reach the egg, and when it's fertilized, it would like to form an embryo, so it gets implanted within the uterus wall. However, this stops it from doing it. So it doesn't stop fertilization from occurring, but it stops it from being implanted. Alternatively, it can release hormones, or it could do both. Okay. One thing it does do, it releases copper to stop you getting pregnant and protects against pregnancy for between 5 to 10 years. Okay. It's sometimes called a coil or copper coil. So you place it in, it's there all the time. When inserted correctly, IUDs are more than 99% effective. So effectively, they are the best ones so far. The IUD, instead of releasing the hormone progesterone, like the IUS, the IUD releases copper into the womb. So there are two different versions to this. One produces copper, and the other one produces hormones. So IUD releases copper and IUS releases hormones. For the point of AQA, they are both IUDs. Okay. The copper alters the cervical mucus, which makes it more difficult for the sperm to reach an egg and survive. So the copper interacts with the mucus around the cervix, and because it interacts with it, it stops the sperm from basically getting there, or allowing the sperm to reach the egg. It can also stop a fertilized egg from being able to implant itself. Okay. So again, I'll give you 30 seconds to get any information you haven't got down. This is one of those methods that are both. Remember, it's both barrier and hormonal. Okay. So the next method is a barrier method 2, and that is sterilisation. Now that is generally a permanent, or sometimes now a semi-permanent situation. It means that you don't ever have to think about, for example, when you are to have sex, you don't have to do anything because it's all pretty much done surgically beforehand. So let's talk about female sterilisation. So female sterilisation is an operation to permanently prevent pregnancy. But what happens is the fallopian tubes are blocked or sealed to prevent the eggs reaching the sperm and becoming fertilised. So they just block them. Depending on the method used, you would either have a general anaesthetic, so they'd put you to sleep, or a local one, where you'd still be awake but you won't feel any pain, and they just do it in the local area. Eggs will still be released from the ovaries as normal, but they'll be absorbed into the woman's body. Okay? And therefore, they will never ever reach the sperm, and the sperm can never reach the egg. So that is a permanent method. The male version is called a vasectomy, and here, as you can see from the image, from your testes, of which there are two, there are two tubes, or a tube each, called the vas deferens, or in this case the vasa deferentia, and those two tubes link up with the urethra via basically going and collecting fluid through your prostate. So you can see that's what happens there. Now that's where your sperm is released. Okay, so that sperm, by cutting those tubes, never get a chance to come out of the urethra. So let me be clear here, though, because this is a common misconception. It doesn't mean that there is no ejaculation. The ejaculation will still occur. There will still be semen coming out. It just won't have any sperm in, because the semen doesn't come from your testes. It comes from your prostate gland. Okay, so the liquid that comes out comes from there. The sperm comes from your testes. It's a common misconception that people think in terms of vasectomy. Okay, so a vasectomy is a surgical procedure to cut or seal the tubes that carries a man's sperm to permanently prevent pregnancy. It's usually carried out in local anaesthetic. You're awake, and it takes around about 15 minutes. A vasectomy is more than 99% effective. The reason why it's not 100% effective, because on some occasions, the body's very good at rejoining the vas deferens. Okay, so the tubes can be rejoined. Now, you can reverse vasectomies, and and some people have. So, you know, for example, they may have decided that they don't want kids. Situation changes, whatever that situation is, and later on in life they feel, actually, I do want a child, but then they'll need to reverse the vasectomy. So you can reverse it. Okay, so there we have sterilisation of both male and female. I'll give you 30 seconds. Okay, pause the video if you've not managed to get that information. Okay, next one, probably the most well-known, as with condoms, is the combined pill. It's often called the pill, but actually it's called the combined pill, and I'll go as to why it's called the combined pill in a second. Now, this is a hormonal method. So far, we've spoken about barrier methods. This one's a hormonal method. And what happens is that we have artificial versions of estrogen and progesterone, hence combined because it's got two, which are produced naturally in the ovaries. The pill, what does it do? It inhibits FSH. So it stops FSH production. And if it stops FSH production, it means that no eggs will mature. If sperm reaches the egg, pregnancy would normally happen. However, this sort of contraception would stop that because the egg is never released. Okay. When taken correctly, this pill is 99% effective at preventing pregnancy. This means that only 1 in 100 people get pregnant in a year. It's important, as it states, the usual way to take the pill is 1 every day for 21 days. You need to take it at the same time every day, and you cannot miss one. Then you stop for 7 days, allowing you to bleed to take a period, and then you start the pill again after 7 days. There are some pills now that can be taken continuously without a break. Okay, important to recognize that taking the combined pill isn't just about contraception. Some people take it, particularly when you're young, actually. Some people take it to regulate their cycles. So because they want regular cycles, so they can control when the bleeding or the period takes place, it's really important that they take the combined pill to regulate that cycle. However, it's so important if it's still used as a contraceptive method that is taken at the same time every day. Once you don't do that, then hormonal imbalances occur and it might not be as effective. That's where generally pregnancy occurs. Okay, so 30 seconds on that one. Okay, hopefully you managed to get all the information down. If you haven't, just make sure that you pause the video. Next is the injection, implant, or patch. They all work fairly similar. It's a female, obviously it's for females. However, they are developing a male patch, so let's see what happens in the future. What does the implant do? It lasts for 3 years. It releases progesterone, okay, and because it releases progesterone, FSH is inhibited, and the implant is 99% effective. The injection, again, releases progesterone, so it works fairly similar. It's commonly given in the UK and lasts for 13 weeks, so you don't have to think about it. These are the advantages of the implant, injection, and the patch. You don't actually have to think about it in terms of when you are having sex, like the condom or the cap. So there's no planning involved as such. Well, there is long-term planning, but not any short-term. And the contraceptive injection is more than 99% effective. And then there is the patch. Again, hormonal. What does it do? It releases hormones through your skin. It is 99% effective. Each pass lasts for a week. You can change the patch every week for 3 weeks, and then you can have a week without a patch. Okay, and that's for when you wish to bleed. So we have got implant, injection and patch. I'm going to give you 30 seconds. They're hormonal. However, you'll probably need a bit longer for those. But they're all pretty much similar in terms of their effectiveness. Okay, so that's the implant, injection and patch. The next one we're going to, or the next two I should say, are barrier method. So we're back to barrier. And spermicide. I mentioned spermicide earlier. Now, spermicide is a contraceptive substance that destroys sperm. It just kills it. It's inserted into the vagina prior to intercourse. Okay, and generally you can just place it with hands or with fingers, or you place it on a cap, and it's always on the outside of a condom, which is why a condom is generally slippery, because spermicide can be used. However, you can just use it by itself because it will kill the sperm, but people tend to put it on something. However, the pregnancy rate experienced by couples using spermicide is higher than the other couples. That is because it's not as effective. You may miss a part, particularly if you're inserting it vaginally. You may miss a part of the vagina that you want to place it. You may not place it fully around the cap, for example. Most condoms come with it already on. However, some people would prefer to place spermicide on it. Again, you need to be organised, and it's something that occurs before the moment, so to say. So spermicide is a method there. And another method is abstination. Now that's a common method, actually. When you think about people who abstain, and it could be for various reasons. It doesn't have to be religious. It doesn't have to be because you believe in sex before marriage. No sex before marriage, I should say. It could just be because you're just abstaining. And that's absolutely fine. For whatever reason, you can abstain. And that is clearly the biggest barrier method. Okay, so abstination or spermicide. I shall give you 30 seconds to get those two down. Obviously, abstaining is 100% effective, by the way. If you don't want a child, you do not have sex. Okay, so in front of you, you should have got all the various methods of contraception, either barrier or hormonal. We went through each one and discussed whether one was barrier or hormonal. The second question we asked was, how does it work? So we have at least a sentence or an understanding about how each method works. And the third one is about the effectiveness of each one. So what I've got for you now are some exam questions that relate to this topic in particular. So we're going to have a bit of time thinking about it. Now, I appreciate that you've just written all this information down. You may not be able to remember it. That's absolutely fine. Use your notes to answer these questions if you have to. Some of you will just remember it, and that's absolutely fine. Some of you will need a bit more time, but you can use your notes to do that. So question number one, and I shall give you 2 minutes to do so. Question number one, contraceptives are used to prevent pregnancy. Draw one line from each contraceptive to the method of preventing pregnancy. So there are 3 there. Contraceptive device, and it's something that you have to recognize. So this is from an exam question where you've had to recognize. And then the method of preventing pregnancy. Now, I'm not going to tell you what those 3 are, but I will just quickly run through the methods. So contains hormones to stop eggs maturing, prevents the sperm reaching the egg, kills the sperm, slows down sperm production, or stops an embryo implanting in the uterus. Okay, so from our notes, we should be able to answer those 3. Now, what you obviously can't draw lines to it, you'll just have to write them down, but you've just got over a minute. Okay, we will go through these answers at the end. So that's question 1. Let's have a look at question 2. So the pie chart shows the percentages of people who used different types of contraception in the UK in 2016. The people are aged between 16 and 49. So you can see you've been given some numbers: other 21, IUD 6, pill and condom. I'm not going to tell you what percentage it is. It seems fairly straightforward. And then no contraception. Part B, determine the percentage of people who used no contraception. And then part C, suggest 2 reasons why a person aged 16 to 49 might not be using contraception. Why might they not be using it? Okay, so there are 4 marks there. I will give you 2 minutes. Okay, so hopefully we managed to get those answers down. If you didn't have time, just pause the video and we shall move on to the next question. So what we've got is a table in front of us that gives us some information in regards to different methods of contraception. So we've got the combined pill, the male condom, and sterilisation. And this is a classic question that gets asked a lot. You're given the percentage effectiveness for each one, and then you're given some other information. Okay. A man and a woman plan to start a family in 5 years. So they want to start a family in 5 years, but they do not want to start a family now. That's important. Compare the risks and benefits. It doesn't mean just state the information again. Compare the risks and benefits for this couple of the 3 methods of contraception. Now, this question is worth 4 marks. I'm going to give you 3 minutes here, but you can have 4 minutes if you need. So what you need to do is compare the risks and benefits for each of those methods. So you've got combined pill, male condom, sterilisation. A sentence on each one with a compare and contrast. Why is it good? Why is it bad for someone who wants a family in 5 years? 3 minutes. 2 minutes. Okay, so if you need more time, just pause the video, but let's go through some of the answers. So question 1 was a kind of match the box. If I'm correct in thinking, the order was that there was the combined pill, the IUD, and a condom. Okay, so those were the 3. The combined pill releases hormones to inhibit FSH. Okay, so that's what that does. The IUD stops implantation of an embryo. Okay, and then the sperm is a barrier method that stops the sperm. What am I on about? The condom is a barrier method that stops the sperm from reaching the egg. Okay, so that's that one. Part B, if you looked at the pie chart, it had two 25%. So what you had to do was just add the two 25%, which would give you 50, add the rest of it, and then minus it away from the 100, okay, to get 23%. Why is it that they don't need to have contraception? Lots of reasons. They may not be having sex. They may be past the menopause. Therefore they can't get pregnant. They may want to have a baby, or any other reason. Actually, it could you could actually put for religious reasons, but that would have to be linked to not having sex. You'd have to actually say what it is. Okay, so any of those two you can see from the mark scheme. And then part D, the final bit, what you needed to have done is you needed to really, as it states, you could have written like a little subtitle: combined pill. Advantage, as it says, easy to take, very effective and free on the NHS, but disadvantage, causes headaches and has side effects. Condoms, advantage, only need it when you have sex, not expensive, even free to some extent, and then disadvantage, not reliable and difficult to use, and you have to remember, sterilisation, 100% effective. D, you won't be able to have family, and there are risks of surgery. Okay, so that is... They are the pros and the cons, the advantages and disadvantages of each one. Okay, hopefully you manage, and you can see how you would get that. If you put 1 for each, you would have easily got to 3 or 4. If you didn't write about each one, then you cannot get into the top bracket, which is 3 to 4 marks. So hopefully that was out of 1, 3, 4, 5. That was out of 9 marks. Oh, sorry, it was out of 11 marks. So 3 marks for the boxes. So if you manage to get at least 6 or 7, you've done quite well. Okay. If you haven't, go through the answers and check them. Right. That is the end of this lesson. This is a lesson on contraception. So this was B5, lesson 8, contraception. I bid you farewell. and I'll see you, or you'll hear from me in the next lesson. So thank you very much for joining me, and I shall see you next time. Goodbye.